I'm Colleen Urbach. I'm with the HAP Foundation.
I'm Kelly Michelson. I'm a professor of pediatrics at Northwestern University and attending physician at Lurie Children's Hospital.
Dr. Michelson, first, I wanted to thank you for taking the time out of your very busy schedule to talk about missing pieces. And to give a little background on Missing Pieces, it's a program of the HAP Foundation that supports grieving families after the loss of a child. So as a co-founder of Missing Pieces, can you share the story of how the program was founded?
Yeah, of course. This was sort of an idea, started with an idea that Kristen James and I had literally as we'd get on the elevator. Kristen used to work with me at Lurie Children's Hospital, and we often talked about how there was a really important need to do more research and have a better understanding of how to help families and communities after the loss of a child. And when Kristen started work at the Greater Illinois Pediatric Palliative Care Coalition, she and I felt like this was a wonderful opportunity for us to really think very broadly about how to help people in this very difficult situation. And so, with this spark of an idea, Kristen and I got a little bit of support to buy as many people lunch as we could identify from across the city who might have any interest in this area. And we came at it very open-minded in the sense of thinking about who did we want to help? How did we want to help? We really had no preconceived ideas about this. And so when people would ask us these questions, we would just say, yes. Do you want to help little kids? Yes. Do you want to help big kids? Yes. Do you want to help families? Yes. Do you want to help healthcare providers? Yes. And that was really how Missing Pieces grew. And as we brought people together, it was really remarkable how much interest and need there was. Getting people to come together and talk about this was not difficult. Asking people to think collaboratively about what was needed and how we could be helpful was not difficult. There was a lot of people with a lot of interest, and it became very apparent very quickly that Missing Pieces was needed.
That's great. Thank you for that. And what do you hope is the future of Missing Pieces?
Yeah, so from this little spark of an idea, Krista and I have started working to support people in the Chicagoland area, but I think we aspire to bring the resources, the mission, the goal of Missing Pieces far beyond the city of Chicago, far beyond Illinois, and really across the country. People after a child dies are literally just trying to figure out how to take their next breath. And this is happening all across the country. So, one of my really big aspirations is that Missing Pieces is an entity that's available in every city and town across the US, and that through that expansive effort, we can really help people find resources that they need. We can provide a community for people delivering resources, and we can provide education to people who are not used to situations when a child dies, but are often confronted with it unexpectedly.
And so, speaking of communities, how do you see clinical grief education changing communities, either in Illinois or across the country?
Yeah, that actually is another reason why I started Missing Pieces, is that I personally saw an important need to educate community members about how to support people after a child dies. And it came because of a very personal experience that I had with one of my kids. When my older child, Owen, was in kindergarten, one of his classmates died of cancer. And we were sitting at the dinner table talking about school like you usually do. And I said, Owen, how's everyone doing at school? And he looked at me and he said, Mom, we're not supposed to talk about that. That's what our teacher said. Don't talk about that. And I was sort of flabbergasted that anyone would try to push away any child's question about a difficult situation. We know that that doesn't help, that when kids are asking questions, it's because they need answers. And so it became very clear that community members, teachers, sometimes sports teams, coaches, all these sort of different people who are affected either directly or indirectly when a child dies, even in the healthcare setting. Some people are not used to seeing children die, and when it happens, and we have to be the person to help the family, it's important that everyone has some advanced information and education. And so this touches all aspects of our society, from healthcare to schools to sports teams to your neighbor down the street.
Yes, definitely. Thank you so much for sharing that and sharing your expertise with us on this, because it is something that I think a lot of people are unfamiliar with, and unfortunately, like you're saying, unexpectedly may need to face it at any time.